Is wine just a cancer-causing toxin, or can it be part of a healthy lifestyle? The headlines are confusing. Some say any amount is harmful, while others say that moderate wine consumption can have health benefits. Wine has been around for 8,000 years, part of our culture, our food, our daily life. But is all of that being called into question? Do we need to trade in our corkscrews for kale smoothies? To answer this question, I met with Dr. Laura Catena. She was in town for a busy conference. She didn't have a lot of time, so we had to capture this one on the fly. It's not our usual filming conditions, but the conversation is definitely worth listening to. Dr. Laura Catena, thank you so much for being with us today. You are a physician, you are a researcher, you are also, of course, a wine producer from a multi-generational wine family, Catena Zapata in Argentina. What made you want to speak out about wine and health?
Well, I've started finding all these articles that were presenting, sort of a black and white picture, no safe limit, all these harms about alcohol, but mixing moderate consumption with excess consumption. So you would read the article and you didn't know what they were talking about. And I felt that there was a lot of misinformation in the mainstream media. And I felt that as, a fourth generation producer, somebody who cares about farming, about moderate drinking a lot. I'm a physician. I know drinking in excess is harmful.
Yes.
I needed to speak up.
And what were you finding in some of these, we're seeing these headlines that say no amount is safe, linking drinking alcohol to as bad as smoking, increasing cancer risks. What do you find was getting distorted in these headlines?
Well, I felt that whoever was writing those articles was trying to get attention.
Yes.
And sensationalism gets attention. You're a journalist, you know that.
Yeah.
And I just wanted to go back to what do we know scientifically and what do we not know?
Right.
And the reality is that the data is not that clear because a lot of the advice on, alcohol is does it cause this, does it cause that, is based on observational data, which means these large amounts of people are asked questions in questionnaires.
Okay.
This data that shows the longer life is based on 2 drinks a day, up to 2 drinks a day for a man and up to 1 drink a day for a woman.
Right.
That's the NASEM study, a recent study in the US. They did a meta-analysis of 15 years of data.
Okay.
And they came up with these associations. So if you ask any of the researchers, they'll say, I can't tell you for sure. We just see this in the data. The longer life and this increase in breast cancer, but, lower all-cause mortality.
But playing the devil's advocate, if there is an increase in risk, let's say in breast cancer for women and other types of cancers, why not just cut alcohol out altogether?
That's the thing. There's an associated risk, and every person can make their decision. So I do tell people that if the only thing you care about is cancer, and a lot of people really worry about cancer because they've had a lot of friends have cancer, relatives. I think we all know somebody that's had cancer. Cancer is very common. And they don't care a lot about heart disease because maybe in their family they don't have a lot of heart disease, although heart disease is the biggest killer. And that's where we see these associated benefits. In terms of cancer, we do see this slight increase in breast cancer risk, not in death from breast cancer.
Right.
Which is not going to make people feel that much better. I mean, like getting breast cancer is a really, stressful thing.
Of course.
But more people die of heart disease than of cancer. And also there's several studies that show that women who take folate, which is in a multivitamin, so folate supplements, did not have that increase in breast cancer with moderate drinking. It was a great article in the Wall Street Journal where they actually asked some oncologists, what do you tell your patients? And this one oncologist said, nothing different than I've told them for the last 40 years that I've been an oncologist, which is it's okay to drink wine a couple times per week and with festivities, just don't drink every day. And I think he had recommended no more than 3 times per week.
Okay.
And so even, a cancer specialist is not going to tell you to stop drinking because it's very possible that drinking a little is not harmful.
You were talking earlier about cardiovascular benefits.
Yeah.
What exactly are those? How does that work?
So that's a great question because actually the American Heart Association did a study where they found that if you told people that drinking wine is better for your heart, they will tend to drink more and in excess.
Yes.
So it's very dangerous to tell people, hey, this is good for you, go ahead and drink, because they'll say, oh, well, if one glass is good for me, two is better. So the harms of excess drinking are many. There is a tradition of drinking wine with food, Mediterranean diet, and the reason why I think some studies do show that wine, as opposed to beer or spirits, might have more health benefits.
Yes.
It could be related to the polyphenols, but it could also just be related to the pattern of drinking.
Of
so
course.
If you're drinking less, you're not binge drinking, you're drinking with food. When you drink with food, your alcohol level goes up less.
Yes.
And so the toxic acetaldehyde doesn't build up. So again, everything matters. And that's why I don't think you can generalize about what's right for a person. You shouldn't drink for your health.
No.
You should drink if you enjoy it, if you're able to drink moderately.
If your body processes it.
You should also be thinking a lot of your diet, because you're drinking, which maybe there's some risks. So let's make sure that you're exercising, that you're having really good food, and that when you're drinking, you're with friends and family. Loneliness is a big issue right now. So if having that little glass of wine is going to make you be with other people and have a great moment and be maybe a little happier.
Build more social connections. Yeah.
But really think about it. Is it doing that?
So I'll give you one last question.
Yeah.
Conscious of your time. If you wanted, let's say, a middle-aged woman, very healthy, active, who enjoys, she'll say in her 40s, enjoys drinking wine, not to excess, but sees these headlines and sees this, relative risk being bandied around in the headlines as though they're definitely going to get breast cancer if they drink, and they think, do I need to stop? What do you want them to understand? What would be the clear takeaway?
Well, I mean, first of all, I would say that if they don't love having their glass of wine, and they want to be the healthiest possible, and wine is not providing them much pleasure, well, it might be the best option to not drink at all. For me, I really love my glass of wine. If I go out with my husband and we don't drink wine, it's much less fun. I'll tell you a funny story. When I was looking at all this data, I go to my husband, who's also an emergency doctor. Yeah. And we had just gone out to our same place that we go every Friday, to this Italian place in our neighborhood, and we have the same bottle of Chianti every single week, and he orders the same salad that we share, and we each order the same food. It's really boring.
Comforting.
We have the best time.
Yeah.
And I read these articles and I said, Dan, my husband's American. I said, Dan, what I would give our dinner the rating of a 9 out of 10. And I said, I'm not going to give it a 10 just because I want to have something to wish for. Yes. But that, we didn't fight it. We fight a lot. We didn't fight about anything. We had a great time. And I said, if we had not had that bottle of Chianti,
we would not have had
what number rating from 1 to 10 would you have given it? And he looks at me and he goes, a 3? Oh. No, wait. And I asked my friends, I'm like, I tell this story to my friends, and they're like, your husband is horrible.
I think I would have said the same.
No. And I said, no, I agreed with him. Yeah. We both thought that. So if you are me and this is your experience and, you drink in moderation, then if I'm my doctor, I would say, well, make sure you take a folate supplement. Make sure you exercise, you drink fruits and vegetables, which are all, preventative, and make sure you get your mammogram. Yes. But don't stop having that glass of Chianti with your husband.
Thank you so much. This has been illuminating. Wonderful speaking with you.
That was fun. Great.